Nicola. We are here representing these organizations. Edwin Borman on the left, to my left, representing the UMS. And then we have Konstantin Radziwill, who is now the Minister of Health of Poland, my predecessor as President of CPME, but I don't think I'll be Minister of Health, I'm sorry. I could do a lot for the Icelandic Health Service, I can tell you. And then we have Ludberg from Sweden, and then Nicola Bedlington from, she's from the UK, but she represents the European Patients Board. So quite a panel here in front of you. Now, I often say that if you need something done, ask a busy person, and I think that's absolutely true. The people who have turned up here today are all very busy people, and that's why they managed to say, yes, I'll come to this conference, and ignore anything else, find out afterwards how you do it. Because some people say, I can't do it, it's Christmas, I can't do it because it's Friday, I can't do it because this, that, and the other. But the busy people say, yes, of course I will. And I'm sure we have a very fruitful day in front of us, ahead of us. It's a very tight schedule. We have a lot of interesting speakers, and I'm sure this revisiting of the continuous professional development will have some impact on the way we carry out our tasks, each and every one in our countries and in our organizations. So I'm delighted to welcome you here on behalf of the before mentioned organizations. And the conference is on CPD for doctors, improving healthcare, because that's what we as doctors are all about, and it's trying to serve our patients and our communities within the health service. So we see this as an opportunity to revisit a statement that was agreed upon about 9 years ago, also here in Luxembourg, so it was appropriate to come back to Luxembourg to revisit this issue. We want to contribute to improving healthcare for our patients. Now, the statement from 2006 was a follow-up on another one 5 years earlier, which was 2001. So a lot of things have been happening on the professional development level. For instance, in Brussels, the revised Professional Qualifications Directive underlines the role member states play in providing opportunities for CPD. There's recently been a mapping study done by the European Commission on the state of play in the member states, and this was done together with, we did this together with other professions, and this on behalf of CPME was led by Konstantin Radziwill. This of course produced some results which will be interesting to discuss here today. So in this conference we bring together experts from many countries, many dimensions of the CPD process, so we can exchange experience, ideas, good practice. We are very grateful for the financial support of the Luxembourg government. They did support the meeting, the CPD meeting, which was held here in Luxembourg in 2006, and they have done it again. We're very grateful for them, and also honored that the Minister of Health, Mutsch, she has agreed to speak. Her arrival has been delayed a bit. She is arriving about 10:30, so we'll repeat our thanks when she comes. So this means a slight change in the schedule. All the lectures, speeches will be recorded. Everything will be available online. There is a conference app.
the importance and the relevance of the continuing professional development of health practitioners. I am a medical doctor myself, and I have done it when I was practicing. Today, my role is to support member states so together we achieve a common European objective of effective and efficient health systems. Systems that are capable to provide safe and high-quality health care. Skilled and motivated women and men working in our health sector are a true asset, able to adapt to technological changes and to the evolving needs of patients. Keeping up to date with the latest knowledge must be a constant factor throughout the professional life for all of us. We also need to implement the objectives of the European Union Digital Single Market Strategy. We would like to see e-health, mobile health, e-prescription, and other tools in full use by all the health professionals. Our citizens expect safe health care from competent healthcare professionals, no matter where they are in Europe. Unfortunately, the statistics still show some negative trends. This is why it is important to advocate for lifelong learning, and I thank you all for doing so. Last year, we issued a report encouraging member states to include patient safety in undergraduate and postgraduate education, in on-the-job training, and also in the continuing professional development of health practitioners. Cross-border mobility of health professionals in the European Union is facilitated by the Directive on the Recognition of Professional Qualifications. The recently revised directive establishes an information exchange on continuing professional development and best practice for optimizing this across the member states. We can all agree that there is no single or universal way of ensuring continuing professional development. However, individual member states can learn from different approaches elsewhere in Europe. To help foster this important cross-country exchange of information, in the beginning of this year, we published the first comprehensive overview of continuing professional development practices in Europe for health professionals. European health professional organizations, doctors, nurses, midwives, dentists, pharmacists, did a great job in carrying out this valuable study, shedding light on the wide diversity of continuing professional development systems. It also contains interesting policy recommendations on how to strengthen the exchange of cooperation and best practices at European level. I would also like to see more cooperation in terms of prevention, early diagnosis, and early treatment so that our citizens are fit for work. Today's event presents an opportunity to discuss these findings and to address two fundamental issues: the role of continuing professional development as a regulatory tool and its impact on patient safety. I wish a productive discussion and give you all my support. I hope I also get yours, because we have a common goal to create a patient-centered approach in healthcare, and it is better to unite to achieve our shared ambitions. Thank you very much.
So we thank, of course, the Commissioner for Health, Dr. Vytenis Andriukaitis, for his message and his wise words about early diagnosis and early treatment and about patient-centered health services. So it is appropriate next to give the floor to the spokesman for the European Patients Forum. This is Nicola Bedlington, who is Secretary General of the EPF. Nicola, please.
Good morning once again. I'm very happy to be here with you all this morning, and it's a real honour to be with such an eminent panel, and congratulations on this initiative 9 years on from the initial meeting in Luxembourg on continuing professional development for doctors, improving healthcare. I wanted to start my presentation by telling you a little bit about the European Patients Forum and who we are as an organisation. We're an umbrella group of patients, and our vision is that all patients in the European Union have equitable access to high-quality, patient-centred health and social care. We were set up back in 2003, and our role is to be an active, united and influential patient's voice on the collective issues affecting all patients across the European Union with the EU institutions, the key interlocutor. And our members are European disease-specific organisations covering the whole spectrum of disease areas and national patient coalitions from very many of the EU member states. And collectively, through our member organisations, we represent the interests of over 150 million patients across the European Union diagnosed with chronic diseases. Back in 2012, with our membership, we developed a strategic plan for the EU programming period 2014-2020. We identified 6 strategic goals, which I'm sure all of you will identify with. The importance of health literacy, working cohesively on health literacy to ensure that patients across the European Union can really navigate properly their health care. Advancing on truly equitable access to quality health care across the European Union, and we do this through a partnership with many stakeholders called the Patient Access Partnership. Meaningful patient involvement in healthcare design and innovation, not only therapeutic innovation or technological innovation, but also social and systems innovation. Patient empowerment, which I'll talk about a little later in my presentation. Building inclusive and effective, sustainable patient organisations at European, but also at member state level. And finally, non-discrimination. And this particular strategic goal came very much from our young patient community, who wanted us to address robustly the discrimination they're actually encountering on the grounds of health status in their education environment, in trying to find a job, in trying to retain a job, in insurance environments as well. And we're working very closely with the social NGOs dealing with discrimination in terms of advancing that. So this is EPF as an organisation. I'm pleased to report that from our perspective, the EU patient-doctor relationship is very healthy. We've enjoyed strong collaboration with CPME through a set of joint principles that we developed together that were adopted back in 2008, that both of our boards have revisited and reaffirmed in the last couple of months. And this has led to extensive collaboration, not only with CPME, but with many healthcare professional organisations on e-health, through, for example, the Trade and Trust work, through the cross-border healthcare work that was done, and we were very active advocating a health professional patient perspective in the discussions around the directive a few years ago. Patient safety and quality through our joint work on the joint action on patient safety and quality of care, and of course patient empowerment. I'd like to highlight in particular the fantastic work that we've been able to do with the European junior doctors with our young patient community, particularly through a project called Empathy, which really helps to raise awareness among decision makers in the Brussels environment about the realities of living and working with a chronic disease as a young person. And the young junior doctors played a fantastic role in helping us. Sorry. This is a dangerous place. Not very healthy. So coming to continuous professional development, what do patients believe it means for health professionals? First of all, the up-to-date knowledge in terms of making sure that everything is up to speed in one's career, that we're really meeting the professional standards that are needed. Continuous improvement in areas, of course, that are particularly close to us, communication with the patients, patient safety, and indeed, of course, commitment to quality of care. Skills adaptation, acquiring new competence, particularly in the field of new technologies, e-health and ICT supported tools, as was raised by the Commissioner, and also meeting ethical obligations to ensure that professional practice is current and really state-of-the-art. We know that the EU legislation isn't perfect. The revised EU directive on professional qualifications requires member states to take measures to encourage CPD, specifically for doctors, nurses, midwives, pharmacists. However, this isn't mandatory. Member states are not obliged to have a CPD system in place or report on it. And the study to which the Commissioner referred to highlighted that only in 20 of the 31 countries surveyed is CPD mandatory. And I'm very much looking forward to hearing the discussions during the course of today on how to change that rather worrying fact, that rather worrying statistic. EPF believes that a CPD system for health professionals should be mandatory for all EU member states. It should be enforceable and appropriate sanctions should be there for non-compliance. Like many of you here, we believe more cooperation at European level would lead to a better understanding of the needs for CPD and in the longer term to higher quality CPD in the European Union. We feel there are a number of areas where increased collaboration would be helpful. The impact of CPD on patient safety and healthcare outcomes as such, as well as the need for further research in the specifics of that. CPD to better support chronic disease management and self-management, particularly given the major challenges that were confronted here today in Europe that you all know only too well. And CPD for genuinely patient and person-centred care. Also, we believe that we can collaborate more at European Union level, exchanging knowledge on the transparency of CPD requirements. Where does the patient's role come into that? We believe that the patient's experience could be fed in to health professional training, not just CPD, but also earlier training as a valuable learning experience. From our perspective, it can help professionals to understand the expectations, the perspectives and the values of patients, what they want out of that very precious dialogue between patients and their trusted doctors and health professionals. Develop solutions that are genuinely centred around patients' needs. See patients as partners, not simply a problem to solve. We believe the experience of patients can be valuable in developing and designing, but also delivering education and training for health professionals. And again, I'm looking forward to discussing that with you during the course of today. This links very nicely with our campaign on patient empowerment that grew out of a study called Empathy that CPME was also very much involved in. Empathy was a mapping of the state of patient empowerment across the European Union in each of the EU member states, and 3 core tenets were identified. Information to patients and health literacy, the dialogue that's needed between patients and health professionals in designing, co-designing healthcare and social care, but also critically the role of self-management. It's widely acknowledged that patient empowerment is a good thing, but there's little real consensus on what that means in practice, and there's less political will than there was perhaps in the last Commission to put it and keep it on the EU agenda and see it as a genuine strategy towards quality, sustainable health systems of the future. If patients are empowered, they can engage differently, more effectively at macro level and indeed at micro level as well. We've been working very closely with all of our allies, and the health professional community has been really, really supportive in taking forward this campaign. We've had some marvellous examples of organisations putting it at the top of their agenda in terms of their conferences, their work plans, and so on. We launched the campaign back in May last year at a conference in Brussels, and this month we've been developing the charter and roadmap linked to the campaign in collaboration with the health professionals. In 2016, in March, we'll have the high-level roundtable in the European Parliament reaffirming the considerable support that we have from a caucus group of MPs who want to drive this forward and really work towards a genuine EU strategy on patient empowerment. And the campaign will culminate in an exhibition in the European Parliament during the course of the campaign. That will be, in fact, the starting point of the implementation of the roadmap, not the end point of the campaign. The campaign messages are relatively simple and I think will again resonate with all of you. The need for quality information and education for patients to be a genuine part of the decision-making process linked to their health. An acknowledgement of their expertise and knowledge, their experiential knowledge through living with a disease. Equality, they're looking at equal partnership in relation to the dialogue between patients and health professionals, but also in a policy-making environment, really seeing the patient community and their representative organisations as sitting at the table with a contribution to make based on their experience, channeling patient organisations' individual experience through the collective voice, through genuine, transparent, effective, representative patient organisations. And finally, engagement, ensuring patients are able to engage effectively in innovation and healthcare and social care design for systems of the future, to really crack that nut between solidarity, innovation, to make sure that patients can really express their perspective, express their voice. And it's not only about asking and wanting more, it's actually working together on using resources to the best possible ability. We describe the campaign as Patients Prescribe E5 for Better Health Systems. That's the tagline. And if you're interested in supporting EPS in the campaign, if you're interested in taking part, then please, I'd be very happy to talk to you during the course of today on how you might want to do that. And that's a quick reminder of the campaign milestones, particularly the repository of good practice. I know all of you have fantastic networks and will be able to actually share with us good practices, particularly in the area of continued professional development. I'd like to move now to a slightly different theme that I still believe is opposite to today's meeting, continuing professional development for patients ourselves. EPS is committed to supporting patients and their organisations to play their legitimate role in EU health policy making and EU health policy discourse. We do that in a number of ways, and I want to give you a couple of examples. EUPATI, the European Patient Academy on Therapeutic Innovation, is a project funded by the Innovative Medicines Initiative. It's a 5-year project, and we're just approaching the 5th year. We are leading a consortium of 33 members, organisations from the academic arena with a track record in patient involvement, patient education, NGOs like the European Forum for Good Clinical Practice, and the industry. Essentially, what EUPATI is about is to develop and disseminate state-of-the-art information on medicines R&D, the entire medicines development process in 7 European languages, and to really build competencies, know-how and capacity amongst patients and the public to get involved effectively through a certificate-level course in English, through a toolbox available in 7 languages, and through an internet resource. And the toolbox will be available on the EUPATI website at the end of January if you're interested. We're rolling out EUPATI in many of the EU member states through national EUPATI platforms, which again, you're very, very welcome to join. Essentially what EUPATI is about is to facilitate meaningful patient involvement in R&D, to support academia, to support industry, to support the health authorities, the HTA communities, the ethics committees, and this is particularly relevant in the light of the regulation linked to clinical trials. There's some new provisions, new important provisions linked to patient involvement. We need to be ready to play our part. The knowledge, experiential knowledge as patients is vital. We can't do that on our own though. It needs to be complemented by facts and figures about the therapeutic innovation process per se. We also do wider capacity building through our member organisations, national coalition building to strengthen our member organisations in each of the EU member states, and also training support for our European disease-specific organisations through the many opportunities to meet patients throughout the year. The training focuses on issues like health technology assessment, patient safety, quality of care, and of course, transparency. Looking at the policy-specific area of work in terms of how we support our patients to be up to speed, to ensure that they have the continuous education and development on issues. Let me take the example have meetings in every single EU member state with patient leaders, with national contact points, to identify together what are the key barriers and opportunities linked to the transposition of the Directive on Patients' Rights in Cross-Border Healthcare, to look at what an ideal national contact point would look like, and to look at the patient journey, map it out, look at the information and support needs patients need from that moment, that very important moment that the patient, together with his or her trusted doctor, makes a decision to have treatment abroad. All of this work culminated at a meeting in July in Brussels, which brought together policymakers. The Commission was there for a lot of the session, and also national contact point leaders, policymakers from the member states, to really home in on the key concerns linked to information, linked to quality and safety of care, and linked to equity of access. This is a really important opportunity to drive some important political messages home, but also learn from the Commission how they intend to move forward with the Council on ensuring that the directive really works for patients at the end of the day. So that's an example how we've tried to translate supporting, educating patient leaders at member state level and feed that into the policy process. Just to conclude in terms of future steps, I trust and hope that the very cherished relationship that EPF has with the medicines community, medical community at the European level continues to flourish and to thrive. I think it's never been so vital. We have so many really key challenging issues on the agenda tackled together. More specifically, linked to CPD, we would welcome the opportunity to work with health professionals and your organisation to develop concrete, achievable actions towards the integration of a patient perspective in professional training. There's pockets of very good activity. There are some pearls out there, some examples of where patient involvement has really played a key role. We need to make that a bit more systematic, a bit more structured, a bit more effective. And recommendations to this effect will be included in the multi-stakeholder roadmap for patient empowerment that I described earlier, in close collaboration, in close consultation with CPME and the European Medical Association. So we look forward to working with you on that. Thank you very much for your attention, and I'm very excited about what I'll learn today and also hopefully my contribution. Thank you very much.
Thank you, Nicola. Thank you very much. I was a bit worried about your safety when you stumbled up there. Thank you very much for this. Now we go on with our agenda. The next speaker is Professor Janet Grant. She's the director of the Center for Medical Education and Context and the Simon Center for Distance Learning. She's emeritus professor of education and medicine at the Open University in the UK. Professor Grant, please.
Thank you very much indeed, and thank you for the invitation here. And I apologise to those of you who have heard me say exactly the same thing in Stockholm last week, or in Cologne a little bit before that, or indeed in the United Kingdom. But it seems to me that there's no point in changing the message continuously. And the message that I have been mentioning in these locations is always the same, and it's based not only on research but also on good theory. So this is about, and I hope on good intention. So this is about working and learning in the service, and it's about managing continuing professional development. I'm an educational psychologist, and what I know from that is that the best education is that which is well managed. The secret isn't about teaching and learning methods, it's actually about management. And it's also about purpose. So there are a number of things to think about. When there's something yellow, it's something you should think about. What is the purpose of continuing professional development? I mean, we can say patient safety, but purpose is something that has to be really quite specific in order to make it operational. And there are lots and lots of purposes of continuing professional development. If you talk to different people, they have different purposes. Obviously, for patient safety, it's an ethical responsibility, but if you come from where I come from and where a lot of people come from, for cost effectiveness, for regulation, for improvement, for actually the personal and professional satisfaction and development of the individual. That's actually fairly important. I do want my doctor to be happy both professionally and personally, and maybe to meet international standards. And we live in a bureaucratic era where everything is like standards and regulations, so we might as well say to meet international standards. And in a place like Europe, with the freedom of movement, that's actually quite important. And all of these contribute to the improvement of the service as such. So it's for a whole variety of different reasons that we do continuing professional development. The question then is, how can we develop a system, a managed system, I would say, that actually delivers all of those different benefits? And I think that's perfectly possible. The universal approach, where there is an approach, is the collection of credits for activity. Well now, I have no idea why, other than that we're in a bureaucratic era. So, what are the strengths and weaknesses of a credit-based system? You all know the answer to that. If we all talk over coffee, you all know how this works and doesn't work. And yet somehow we never say so. Well, let's say so. Is collecting CPD credits actually effective for any of the purposes that we were talking about? Well, obviously, for bureaucratic era, it's very effective. But there's never any rationale for the award of credit. One lot of people say you get lots of credit for this and not much credit for that. Others say you get lots of credit for that and not much for that. If you look in the United Kingdom, where I come from, the medical royal colleges, they all take different views. There's no reason, there's no rationale, there's no evidence base for any of that at all. So there's no rationale. There's no systematic relationship of the award of credits to need. The need of the healthcare service, the individual. In fact, the award of credits is often a perverse incentive to do the wrong thing, but to tick the box, that's fine. There's no evidence of the effect of collecting credits on practice, and you would think with something, numerical like a credit, you could do something that looked like a bit of correlational research or something. No effect, no evidence, but that's actually the nature of education, that the collection of evidence is very, very difficult, but that's a different topic. And very often doctors can just participate in it for the ease of a meal. And it has been known for people quite sensibly to say, what's for lunch? I'm coming to your meeting, or there's a better lunch somewhere else. I don't mind that. It's sensible. So, is collecting the CPD credits effective? Well, probably not really. On the other hand, of course, we need to be balanced. Credits do give the opportunity for CPD. It is actually a public statement that CPD is important. So I think that's good. If you've got to collect your credits, you've got to do it, so that's a good thing. Fine. And it's good for bureaucracy. But there are problems with collecting these credits. It's actually an isolated process. Who else runs around? I tell you what, who else runs around collecting credits for work? I'll tell you who else runs around collecting credits for work. 3-year-old children who have stars on a board are the other people who run around collecting credits for their work. And nothing in between 3-5-year-old children and you. So, it's an isolated process. It's not systematically linked with either personal or service need. It is linked with collecting credits. And credit recognition systems don't recognise the actual effective ways that doctors have of learning. Because learning, as an educational psychologist, what I know is that learning is a process. It's not an event. So we need a bit of help here. And because learning is a process, we can actually collect credits for that process. And that's all I really have to say. We collect credits, if you've got to collect credits, let's have that discussion, for a process. But how can we do that? Well, we need to ask ourselves what qualities we think that a system of CPD should actually have. And that's a long discussion as well. So, how can CPD be, for example, transparent and accountable? Because we live in that era. How can it be regulated? Because we live in that era. How can it be relevant in to all of that is by using credits that recognise the process of learning rather than an isolated event. And what we did, we did some work which you'll all know, which is reported in this book, which we did for our Chief Medical Officer in the United Kingdom, who wanted to know what made CPD effective. So I knew what the answer was actually, but I thought we'll do this piece of work because it's important to talk about these things rather than simply to make assumptions. And what came out of the work that we did, which is reported in this book, what came out of the work that we did was a simple 4-step process, which is the process that makes any learning effective. And there's a literature review and so on that backs all this up, as well as a lot of work that we actually did with doctors. So, what you do is you simply say, well, what am I going to learn? And why, obviously, am I going to learn that? And there are many, many reasons for learning. There isn't just one. There are lots of reasons for learning. Some look back to put things right. Some look forward to something that you don't even know might be going to be happening. You're a profession. You're not a trade. That means that learning is quite difficult to define in any instrumental way. Professions are broad. They deal with the unpredictable. They deal with complexity. So this makes identifying learning needs just a little bit tricky. So maybe there are good ways of doing it, which involve reflecting, which involve saying what you know to be true. So, what are you going to learn? How are you going to learn it? We'll come to that. Then go away and learn it. That's good. And then somehow use that learning, because educational psychology doesn't know much. It knows that feedback's a good thing, and it knows that reinforcement is a good thing. Use what you learn and it's fine. That's about all that educational psychology actually knows. So we need to use the learning. That doesn't mean to say return it to practice necessarily, because sometimes you can't. How are you going to go back now and return to your practice what you've heard today? I can tell you right now you're not, because you can't. You'll have a strategy, however, which will make things, in the end, we hope, improve. You can go back and you can talk with people about it. You can think about it. You maybe can change things if you're in a position to change things a little bit here and there. That's the way things develop. So use your learning. And if that involves going back and discussing with your colleagues, that to me is use. If you go back and you change your practice, that is equally use. So use it. So it's a simple 4-step process. It's not that difficult actually. And sometimes you feel the need to say something that sounds awfully intellectual. Sometimes saying things which sound awfully intellectual just aren't real. And sometimes something simple is. So I don't mind simplicity, which is probably just as well. So let's think about this. How do senior doctors learn? Well, these are perennial problems that particularly people in medical education always asking, how do people learn? Well, a degree in educational psychology will tell you. But research and experience tell us, there we go. I wanted to say this, because this has got forward by my good colleague and friend Thomas Singh, who has always encouraged good thinking about CPD in Europe and way beyond. So, how do they learn? Well, there's this thing called situated learning, which is the process of professional education, which refers to the process of professional education and its dependence on immersion in practice. So learning arises from practice, and it's immersion in practice that CPD is dependent on. That is not true in an undergraduate student. That is partially true in a postgraduate. It's very true in somebody who is a practitioner. So the nature of learning and the nature of need for learning changes at different stages. So the first thing about people in CPD, a stage of CPD, is that they are immersed in practice, and that immersion changes at each level. And every doctor learns in their own way. There is no best way of learning. There is no widely shared preference. Please don't distribute questionnaires about learning styles. They tell you nothing other than this is the result of a questionnaire about learning styles. So there's no widely shared preference. How people like to learn depends on context, depends on culture, depends on purpose, depends on you, depends on who you're with, depends on how much time you've got, how much money you've got, what you want to learn. It all depends. So that's a challenge for a credit-based system that sets different values on different ways of learning. And as we know, CPD is not an isolated event. It's actually an integral part of a doctor's professional life. It's not a separate stream out here. You know, and if you identify it as a separate stream out there, it will stay that way. And the perverse incentive is that's my CPD and this is my professional life. That doesn't work. So the challenge then is to support doctors' own ways of learning, not to force them into different ways just because those ways might be measurable and observable and something else. So how do we set about enabling that? Well, doctors learn effectively in different ways. There's no best learning method. And in terms of how you're going to know what you're going to learn, effective learning can actually be related either specifically to a need that you might have because something happens in your practice or somewhere or another, and you go, oh, I need to learn that. Fine. But it could be, I just need to go to the big European conference on thyroid because I want to know what's going on. Of course you do. I want you to know what's going on because I never know in what way my thyroid might be going wrong at some point in the future, and neither do you. But you need to be prepared for it so you can just go and see what's going on. That is fine. Learning at your level is not an instrumental thing. It's a professional thing. So just linking CPD to known needs is not going to prepare for the future, for uncertainty. It won't promote development of the individual or the profession. Learning on the basis of needs is backwards looking. It's putting things right. It's not developing for the future. So CPD can't be used instrumentally. And there must be a large element of personal professional choice. So, what's going to be learned in this individual way? Well, sometimes, of course, there is a need to teach healthcare professionals about something new that happens that involves you all. HIV some time ago might have been Ebola. We have students on our courses dealing with that. That's something they needed to get up to speed with. Sometimes these things happen, but in general, there is no CPD curriculum, and we did work at the Open University on that. There's no CPD curriculum. There should not be one that's pre-specified. You're all individuals, and actually, in other research, which I'm not going to mention, the longer you're in practice, the more individual you get. The more different from one another you get. So we can't specify something that all of you actually need. What you need, and by the way, I'm saying need, but I don't mind what you want either. I've been to so many meetings so I can say, oh, doctors just study what they want to study, not what they need to study. I can't even engage with that. So it must arise from practice, from the judgment of doctors, and from the emerging health service. I'm saying needs. I think I'm going to take that word out of this, actually, from the emerging health service. So, no CPD curriculum. Ensure, certainly, that CPD is related to practice. Well, it will be anyway, but you don't share common learning needs. Your learning needs, interests, wants, wishes come from your practice and from your general interest in your subject. A profession is an academic entity. I'm an academic. You know, I'm just generally interested in theories and ideas and what people are saying in my field. And so are you. To be a professional is to be an academic. It is not to be a tradesman. And that makes CPD a very different thing for you. So the challenge here is to find ways of supporting individual doctors to identify what they need or want to learn, coming from their practice and maybe feeding back into their practice. But you can't always feed your CPD back into practice. We know that. Because when you go back, there's not the money, there's not the time, there's not the kit, there's not the facilities, there's not the circumstances, there's not all sorts of things. But one day. So, do we need to teach doctors? Oh, gosh. We hear so much about in undergraduate education and so on. We need to teach these people lifelong learner? Do you think your brain shuts down when you leave medical school, or maybe it was never even opened inside medical school? Have you never learned anything in the past 5 years? 5 days? 5 hours? You learn all the time. You're learning machines. This lifelong learning thing, rise up. Stop allowing people to say these things about you. So, do you need to teach doctors the skills of effective learning? Well, it's all in the good CPD guide. We asked, can doctors identify their learning needs? This is what we did for the Chief Medical Officer. Do you meet the needs of the healthcare service? People say that, oh, they just do what they want to do. They don't care about the healthcare service. Like nobody cares about the place they work. Do they continue to learn? Nah, of course you don't. Do they show effectiveness and reinforce their learning in practice? Well, we asked. We found, and we stopped asking, because it just gets dull, really, when they keep telling you more and more things. Do you identify learning needs? Well, after they identified 48 different ways of identifying their learning needs, we said enough. Okay, we know, you do know. It's just a matter of somebody recognizing that you know. 48 different methods of saying, yep, I need to learn something. Do they meet the needs of the healthcare service? Well, yes, actually, because that's where they work. And do they continue to learn? Yeah, we said to people, when did you last learn something? It just came out. When they gave us 40 different ways of learning, we said, all right, okay, we're convinced. And then do you actually show any way that was effective? Do you bring that back into the service? Do you use it? 41 ways later, we said, stop. We know. This happens, but who recognizes it? What we need to do is to build this into a system, because it's all happening. And somehow what people think is that there's got to be something else out there. Not what you do and you are, but something else. So this is a 4-step system. What are you going to learn? How are you going to learn it, and use that learning. So, identify what you're going to learn. This can be done in any way, and there are 40 however many ways in this book. Reflection, peer appraisal, which fits in with our revalidation, contextual factors, service needs, quality assurance processes. Within each of those, there are many ways that people have highlighted, yeah, I'd like to learn something now. And that does ensure that the intended learning does derive both from what you want to do, from professional development, and from the needs of the healthcare service. It's actually all happening. So, can you identify your learning needs? Just say to yourself, when did you last learn something new? And then when people say you need to be taught to be a lifelong learner, you tell them, I learned something new yesterday, today, from that patient. So we have in the United Kingdom the appraisal process, which fits in with this. We don't regulate CPD, but it's part of the revalidation. So we have a peer conversation. I think peer conversations are quite useful. You might have different ways of doing things. A peer review of doctors' performance. Don't formalize too much. Never formalize too much. That's not the way professions work. Personal reflection. It considers the doctor within that doctor's working circumstance, sets out development perspectives, agrees a learning plan, and seeks support for that learning as part of our revalidation process. Planning how to learn. Well, you can record that. This is the bureaucratic era thing. You can record it in a personal development plan or make another record. You can actually record what you really do. You don't have to set up something different in order to record something. You can actually make clear what you really do. And you can have a rational and transparent record of what you intend to do and why you intend to do it. You can have an action plan if you want to. These things actually make me shiver a bit. I go, I'm not sure that I really want this. It's all just getting a bit too formal. And when you start getting formal, they develop more boxes and more ticks, and then you go, no, that isn't what I wanted at all, actually. An action plan based on awareness and reflection and goal setting and planning learning, but don't be too specifically. For personal development in the context of a career, of the job, of education, of self-improvement, of whatever your purpose is. So, you do need a record. I know you do. Keep it simple. Keep it high level. Otherwise, the record becomes the thing. I don't want the record to be a thing. I want you to be a thing. So, learn. I don't mind how you learn. You can learn any way you like. It's fine, because you do learn any way you like, in a way that is appropriate to you and the circumstance and the thing you want to learn. learning is a personally effective thing. It's not a generally effective thing. How do you keep up to date? Well, methods of professional learning. We found lots, they're all in the book, academic activities, meetings, learning from colleagues, going down the corridor and just asking somebody. Learning from practice, learning from, we hear about e-learning and all that stuff. And there's nothing special about e-learning, by the way. Just because it says e and learning, that doesn't actually mean there's a meaningful relationship between those two things. There isn't. So, learning from technology, if you want to, management, quality processes, learning from your daily activities, specially arranged educational events. Oh, those things that you tend to get credit for, that's one small part of it. There's no rational reason for assigning a credit value to any of these. They are all valid. And then the final step, use the learning and show its effectiveness. Disseminate what you know to other people. Incorporate into your practice. Do further learning. Anything just to use it. So that you carry it back, you share it. How can you take it back to the workplace? We ask people, all of this is on the basis of what we ask, reviewing practice, teaching others, changing practice. Sometimes, don't always, if you want to look at the effects of CPD, please don't expect people to change, and certainly don't expect patient status to change. Because sometimes that just isn't possible. And sometimes people will go to a CPD event and they'll say, well, I was doing it right all along. No change. So, all of that will improve the healthcare service. Can the quality of CPD be measured by outcomes? No, it can't. Because, and this is actually the only reason why I agreed to do this work for the Chief Medical Officer, because I wanted to put a diagram in this book saying educational research is very difficult to do. You cannot show the relationship, a causal relationship between any educational intervention and any outcome. It can't be shown. So otherwise we know how to teach children to read, and we don't, which you've heard me say before. So, there are too many intervening and uncontrollable variables between the learning that you went to and patient outcomes. The conditions of practice sometimes actually stop new learning from being used. And doctors must also acquire new knowledge that might not be predictably used at all. So you cannot measure the effectiveness of learning by patient outcomes. CPD is not an instrumental thing. Sometimes it's just a general professional updating. So, to end, the key to effective CPD is how the process is managed. Any educational psychologist will tell you that. What are you going to do for your learning? And it doesn't have to be formal, If you want to capture learning as you do it, it's all that informal stuff. A patient comes in, you don't know something, fine, you go down the corridor, you talk to a friend. That's learning. That's learning. It isn't about identifying your needs and going to a meeting. It's not what it's about. So, what are you going to learn? How are you going to learn it? Any way you want. Learn it, which you will anyway, because you are lifelong learners, brains are learning machines. And then use it in whatever way you want and it's appropriate. And how can this improve the healthcare service? It derives from the fact that you work in the healthcare service. It is tailored to your individual needs as a practitioner in the healthcare service. You can assure a return to practice because you are the practitioner. And allowing personal learning that suits the individual means that your practice improves. It's transparent and monitorable, that's the bureaucratic era. And it allows targeted CPD when the healthcare service development requires that, and sometimes it does. Formal recognition of the process is required, because that's the era we're in, for credit or certification, but not as an incentive to do it. Absolutely not. Credits are a perverse incentive. And if that is your incentive, you've got it wrong. So, there's a process. 4 steps. There's documentation. We need that. Credit. And make that for the process. And that's for the profession, for the doctor, for the service, for regulation, for transparency and accountability. And that is the process. To help the profession do what you do effectively already. And don't
don't let anybody else tell you anything else. Thank you.
I want to thank Professor Stanislav for her very stimulating speech. And I thought when she said, you know, you maybe find out that you did it right. I just thought I did it right. Now let me welcome the Minister of Health for Luxembourg, who's just arrived towards the end of Professor Grant's speech. I'm sorry about the disturbance, but we are very pleased to welcome her here. This is Lydia Mutsch, and we are thankful for the support that the Ministry has given this conference. And just to remind us all again that we are revisiting a statement that was made by these medical organizations in 2006 in Luxembourg. So it's a very appropriate place to be. And I want to give her the floor. Please, Minister Mutsch.
Thank you so much. I hope that my statement will be a little bit as enthusiastic and passionate as the professor's speech, which I couldn't hear as a whole, but I think it was a very good one. And all my excuses for disturbing your speech. But I intended to be here earlier, but I couldn't make it. So it's now that I am welcoming you very warmly to this important conference, and I'm really impressed to see so many distinguished guests, and above all the Polish health minister, who I welcome to Luxembourg. I understood that you are a personal friend of Dr. Schummer's, so this allowed us to have you with us today, and welcome to Luxembourg. You are a very large audience today, which is to me a sign of the successful work of the European medical organizations, and it's a real pleasure for me to welcome you in Luxembourg. I believe we can bring continuous professional development forward to further improve the healthcare which we would like to offer to our citizens. Luxembourg has been chosen as a host for this conference, and I'm proud for this because we had a very successful meeting of the Luxembourg Council. Yes, I see that I am again with the working group. Thank you. So it gives me the opportunity to tell you a little bit about our presidency now, but the origin of this meeting today has been the Council of 2006, when the Finnish presidency and the Council were here back in 2006, and this had been quite a successful meeting at the time, so this is a good moment now to remember this period when a lot of work was done, and it's interesting for me as well to give you some information of our presidency. So today the continuous professional development is more than ever a necessity, faced by the challenges of an aging population, the new diseases, and the rapid development of new technologies. Our health systems have to be more and more responsive and capable also to propose long-time solutions to the new needs and to the new problems. I do strongly support the organizers in their aim to promote high continuous professional development, and I see this conference contributing to the broader policy aims of improving healthcare, both at national and at European level. Ladies and gentlemen, as I just told you, the Luxembourg EU presidency is slowly coming to an end. This evening the Prime Minister is going to address all the participants, which is the official final act of the Luxembourgish presidency. So it gives me a really excellent opportunity to share some key events and achievements of this Luxembourgish presidency with you, and mainly in the field of continuous professional development over the past 6 months, because I don't think that you are interested in my conclusions as a Minister of Equal Opportunity. So I'm focusing on health today. Firstly, we were pleased to host here at the same venue the joint meeting of the EU Chief Medical Officers and Chief Nursing Officers on the 12th and 13th of October, which was a very privileged moment to share. During one of the sessions dedicated to the training and continuing education of health professionals, the Commission presented its study, review and mapping of continuous professional education and learning throughout life for health professionals in the EU. I believe that the results of this study can help to provide information for continuous professional development for doctors, because both health professionals and doctors are equally confronted by the challenges which were presented by the workforce shortage due to an aging population and the rise of chronic diseases. So they really have to cooperate and work together to improve the situation. Healthcare professionals will need to adapt to new ways of approaching patients. New patient needs and new health technologies require suitable training. They need to develop communication skills with patients to allow for an informal choice and shared decision-making processes. In other words, the objectives of the Commission study, aiming to have a comprehensive and comparative overview on CPD in the European Union, to share good practice and facilitate discussion among policymakers, regulatory and professional bodies, could form an interesting basis for the general discussions on continuous professional development. Secondly, CPD was also addressed in relation to the 2 main public health priorities of the Luxembourgish EU presidency, namely personalized medicine and dementia. I'm proud to announce today that we succeeded to adopt Council conclusions in both fields by the EU health ministers during our final Council on December 7th this year. In the conclusions on personalized medicine, you can read, Member States are invited to provide education, training, and continuous professional development for health professionals in order to equip them with the necessary knowledge, skills, and competencies to make the most of the benefits that personalized medicine brings to patients and healthcare systems, and to ensure appropriate decision-making on treatment options. So this means that the European Commission is called upon now to facilitate exchange of good practices between Member States in this regard. In the conclusions on supporting people living with dementia, Member States and Commission are invited to take forward discussions at national and EU level on the need to promote the role and continuing education of health professionals to ensure the best possible support for people living with dementia and for their families. let me clarify that in these conclusions the term health professionals includes also members of the medical staff. I would like to say that by including CPD in our priorities and Council conclusions, both Luxembourg is the rotating presidency and all the member states showed their commitment and willingness to recognize an important role to CPD in improving best care to these patient groups and for health care in general. To conclude, I would like to express my sincere hope that with this conference we will learn more about the different ways to bring forward CPD management, accreditation, and the relevant regulatory framework so that CPD may contribute on a long-term basis to a higher quality of care and an even better patient safety, which are two main objectives for all of us. There is a real need to develop knowledge about how to respond best to patients' expectations and needs, and the strengthening of continuous professional development is one answer. Last but not least, I would like to thank the European Medical Organization and the National Medical Doctors Association, also AMMD, die hier gut vertreten ist, for organizing this conference and wish them and